This is One-on-One. The beautiful smiling face of Leah Dade.
Oh, thank you.
Executive Director, Paterson Alliance. How you doing?
I'm great, thank you. It's a great morning.
It sure is. In Paterson, where we tape.
In Paterson, right here in Paterson, the third largest city in the state of New Jersey.
Look at you, ready to plug already. Tell us what the Paterson Alliance is. It's special.
Well, we're real excited. The Paterson Alliance is a membership of and collaborative of all the nonprofits that service the city of Paterson. And that could range from nonprofits that are in Paterson as well as nonprofits that are county-wide. And the exciting thing about the organization is that our members consist of some of the smallest of our faith-based organizations to our largest institutions, including William Patt and St. Joe's and Passaic County Community College.
We're actually taping right here at St. Joe's.
St. Joe's is one of our critical partners. We love working with them. And basically, we brought together the nonprofit sector to break down barriers of competition and figure out how they can work together.
Now, we're doing this program in early, mid-March. You have a big event coming up. Plug it real quick.
Yes, we have the Extra Mile Awards taking place on May 10th.
Extra Mile.
Extra Mile. This is where our members come together to recognize those individuals and their organizations who have always gone the extra mile, who are the unsung heroes that people just don't know are behind the scenes really making it happen. And in addition, we are recognizing two community leaders this year, Vaughn McCoy, the past president of PSE&G Foundation and current state regulatory general counsel, and his wife of PSE&G, and his wife, who is the CEO, and Marnie McCoy, CEO of the Community School of Paterson.
They do a great job.
They really do.
Vaughn has taught us so much about Paterson as well. You know, what's interesting to me is the Paterson Kids Count report you're doing in cooperation with the Advocates for Children of New Jersey, one of our not-for-profit partners. This is a Kids Count report that really looks at the state of children in the city of Paterson. Let's look at reading proficiency, children's eating, nutritional, if you will, breakfast, and also uninsured children. First, reading proficiency in the city of Paterson for our kids. Go.
Well, currently what we found out through the Kids Count, which is a statistical analysis that identifies a variety of the indicators that are taking place in children and family across the state of New Jersey. Advocates for Children also does this report countywide, and we partner with them for them to take a very specific look at the city of Paterson.
Never been done before.
Never been done before. This is the first Kids Count in the history of Paterson, and it is our goal to continue this process and use it as really a mapping to determine a roadmap for our nonprofit sector, our funding sector, and our municipality to really follow, to identify key issues and then work towards resolving those issues.
We need to get that baseline information.
Yes, we do. And this has given us some very stark reality baseline, particularly as it relates to educational proficiency. On an average, Paterson children are averaging anywhere between 24 and 30% behind in academic achievement between their counterparts in the remainder of the state. And that's something that we really have to work towards. And so what the Alliance has done is that we have built collaborative partners across sectors to come together and say, this is a problem that one organization cannot solve. But if we collaborate, work together, and leverage each other's resources, we'll be able to solve that problem.
Let's talk about children's nutrition, particularly around breakfast.
Well, you know, interesting. Food insecurity is a major issue in Paterson, and there have been initiatives done to look at the issue of food insecurity. The Paterson Kids Count focused on food insecurity, where we actually identified the quantity of food that was being distributed during our, in a variety of different food pantries. But one of the major areas that we understand that we can have an impact on food insecurity is ensuring that every child has a decent breakfast in the morning at school.
How do you do that?
Well, you know, there are a lot of innovative methods, and unfortunately, as a state, we haven't done very well with this process. Currently, the state of New Jersey is 46th in the nation in serving school breakfast, and Paterson is far behind. We only serve 27% of the eligible children school breakfast every day.
Hold on, let me get this straight. Of the children who are eligible to receive that breakfast, about a quarter get it?
A quarter actually take breakfast. Well, there are a lot of barriers to getting children to school at the time period that breakfast is served. I don't know how difficult it was, but for me as a single parent, getting my daughter up and out of the house and to have breakfast before 8 o'clock or 8:15 in some cases is a challenge. So we are investigating and working on a national initiative that has been taken on nationally to improve school breakfast results, and that is really what we're calling breakfast after the bell.
Breakfast after the bell.
After the bell. We'll breakfast will be served in the classroom. And there are some very interesting statistics that support breakfast being served in the classroom. Children become more attentive. They become more engaged. Less trips to the nurse with the phantom headache and stomach ache.
Oh, believe me, we've seen it in our house.
And so we are working with the school district, who is a wonderful partner in this effort, to begin a pilot sometime in May. 5 schools that have been selected where we will serve breakfast in the classroom in the morning.
Now, the other area that the Kids Count initiative, by the way, we're talking to Leah Dade, who is the executive director of Paterson, the Paterson Alliance, which is a consortium founded in 1998.
Yes.
5 nonprofits. They have a total of 70.
Yes, we're actually up to 75 now.
See, updating all the time. They're doing this for the first time, the Paterson Kids Count initiative, in cooperation with the Advocates for Children of New Jersey. They've been producing this wonderful Kids Count initiative throughout the state, looking at the state of children, where they are, particularly in our most vulnerable areas. So Paterson's doing it for the first time, and one of the areas we're looking at is the number of children who are uninsured. Go.
Well, you know, that was an interesting result to find out as well, particularly since the state of New Jersey has done a yeoman's job in identifying ways to ensure that children are becoming insured in our state. Currently, we have our Medicaid authorized HMOs, and we have 4 of them in the state, and they are authorized to accept uninsured children. Well, across the state, we've seen improvement in the area of uninsured children, and in in Paterson, we've seen an increase and a rise of 10% of children who are uninsured. So what is really exciting about this is that we have brought together those honestly competing partners when you look at it. We have Horizon New Jersey, we have Health First New Jersey, and United Healthcare have come together.
I'm sorry for interrupting. Health First New Jersey, they actually brought us to you.
Yes, they did. They have been a wonderful
Terry Bird
partner.
and those folks, and Aviva, they are competitors. That's interesting.
Isn't that interesting?
With Horizon, they came together. Why?
They came together. Why? Because the reality is that what they want, more importantly, is healthy children, and that speaks volumes, particularly in a time when sometimes people aren't as favorable to the insurance industry. But you know what? They have been wonderful partners. They have put aside the competition and work with us to collaborate to begin identifying what can we do to reach this 10%. First of all, who are they? What pockets do they sit in Paterson? Paterson is extremely diverse, and as a result, we have to begin to look at that level of cultural diversity to identify these children so that we can ensure that they are properly insured and ultimately healthy.
Before I let you out of here, the Paterson Alliance doing important work. The challenges are daunting, but I always see a smile on your face every time I see you. How much you love what you do. 20 seconds.
I really do love what I do. I believe that the nonprofit sector really is the key to urban mobilization. And I believe that so our urban communities go, so our nation goes. And so as a nonprofit sector and with the Paterson Alliance, we really work hard to strengthen the infrastructure of organizations so that they can be the backbone of our urban community.
Can we be part of the Alliance?
We would love to have you.
We got a deal.
Thank you so much.
Funding for this edition of One-on-One with Steve Adubato has been provided by Johnson & Johnson, Health First New Jersey, TD Bank, the Russell Berry Foundation, and by Community Education Centers. Promotional support provided by The Record, North Jersey's trusted source, and northjersey.com. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.